and you need some help, like lubrication. What is the word?
Lubrication.
Oh, you always get it confused because in Brazil we say lubrificante.
Lubrificante.
Lubrificante. Welcome back to another episode of Spilling the Tea with Dr. Hendricks.
That's me.
Yes.
Gabriel D.
That is me.
Welcome back to another episode.
And today we're discussing something that pretty much everyone talks about it. And we discussed this topic in the last 5 videos.
Yeah, I mean, I'm not sure how many people talk about it. It's definitely something that takes a little bit of time to increase your comfort level, and something that I've had to get used to over time. Patients asking me about over the last 10 years.
And also, I'm sure it's not something that you learn in medical school.
Yeah, they skip over the sexual health stuff as it's not very fun for most people to talk about, taboo.
As always.
So-
And we're here to break those taboos and stigmas and talk about it on YouTube.
Exactly. Whether you're gay, straight, or somewhere in between, you can find some helpful information in this video to allow yourself to enjoy maybe something new, maybe something old, maybe something borrowed, maybe something blue.
Beautiful words. Maya Angelou.
Yes, something like that.
So yes, we talk about anal sex many times here, but specifically today we're discussing, is anal sex safe?
Good question.
Is it?
Yeah, well, we're going to find out. Today's basically Booty 101.
Booty 101, I like that.
Yeah, so let's dive into Booty 101 and see what you think about what we come across.
Yeah, so first and foremost, what is the most important thing to consider when having anal sex?
Well, first and foremost, you want to consider communication and consent, because believe it or not, you may be on one page and your partner may be on a completely other book. So you want to make sure you're both okay and ready to proceed with something that may be new for you or your partner, or maybe something that someone else in the situation is comfortable with. So start off by saying, hey, this is what I'm ready to do. This is what I'm not ready to do. So you can both be on the same page.
Yeah, communication is key, and it's okay to say, hey, I'm new to this, or hey, I'm a professional.
Right, because the professional is going to be able to give the new to this some tips, and the new to this is going to be able to say, hey, you're going too fast, too slow, and you can both sort of gauge what you're comfortable with as the process is unfolding.
So let's start with facts and science. What should people know about this area?
First, the anus is not the same as the vagina.
Right.
So it's going to be more sensitive, more fragile. There's no natural lubricant, and the tissue is going to have lots of nerve fibers, meaning that there's going to be pleasure, but also the potential for lots of sensitivity.
Right.
So you want to take it slow.
Yeah, one thing is not the other, and you need to be aware of that.
Yeah.
And so, lubricant is going to be very helpful to, make things more smooth.
Right. So again, that tissue isn't naturally going to be able to lubricate itself as it would for a female.
Right.
And so you want to make sure that that tissue is protected. And the best way to do so is adding lubricant.
And what about those sphincters that everyone talks about?
Right. So a sphincter is typically referring to a musculature that is going to contract or relax depending on the environment and what is giving pleasure or pressure or sensitivity. So we think of two main sphincters when it comes to the male or female anatomy. We're going to think of the external and the internal sphincters.
I see.
So the external sphincter is going to be under our voluntary control, which means that you can tell it, hey, I want you to relax, or hey, I want you to contract. You can also understand that this is going to help us prevent unnecessary bowel movements, things like that. In contrast to the internal sphincter, which is going to be deeper inside and has no voluntary control. Everything is involuntary, meaning that if you are stressed or tense, it's going to be contracting. And if you're relaxed, it's going to be relaxing. You can't tell it to make these decisions. It's going to be doing it for you, which is why it's very important to be relaxed when you're proceeding with things like anal sex.
It's important to be relaxed, and there's no, I swear I'm relaxed.
Right. Your body's going to be able to tell you, and it's going to make it more of a difficult process for you if you're not completely relaxed.
Take a deep breath, enjoy the process, because you're there to have pleasure and fun.
Right. And if you are noticing that you're not relaxed, and this is not something that you're able to do at the time, it's probably a good indication that you should take a break, reset, and come back again later when you're feeling more comfortable with either the person, the environment, with yourself. So listen to your body as well. You don't want to force things.
Yeah, no forcing anything here.
Right.
And so how far are we talking back there?
Right. So when you're talking about the backside, the rectum is about 7 to 8 inches long. And in
Oh,
general, only the first few inches happen to get much action,
that's
right?
true.
The majority of the other action is taking place in the perineum. So that area around our pelvis, that's actually external. That's why it's
Wow.
so sensitive around our scrotum and between the scrotum and the anus. So a lot of that is actually getting majority of the sensation. And then about the rest that's internal is only the first few inches. So if you're thinking that more size is necessarily better, the studies just don't back it up, and neither does your anatomy.
It might be just a fetish or something that you
Sure.
fantasize about size, but
Sure.
not really proven to have more pleasure.
Right. Everyone's got their own preference, but more does not necessarily mean more pleasure.
So you mentioned fragile tissue. What protects that?
Right, so the anus is lined with something called a mucosal membrane. So this is the type of tissue that we would find in our mouths and our GI tract, but what it doesn't do in comparison to our counterparts is that it doesn't self-lubricate. So that means that the anus, even though it is lined with that fragile mucous membrane, it needs lubrication so it can add additional layers of protection. Now, that mucosal membrane is great when we're doing things like bowel movements and normal day-to-day, but when you're considering anal sex, lubricant is a mandatory part of the process. You don't want to skip that because it increases the risk of things like tearing or injuring that
Right.
mucosal membrane. And because it is an area that is typically seeing movement throughout the day, that increases the risk for infection. So we want to avoid
Wow.
all of that by just adding plenty of lubricant.
Mucosa membrane is almost like a drag queen.
Could be. I
Uh,
mean, you can make a name out of anything, but yeah, we'll call you mucosa membrane.
Do I look like mucosa membrane?
Not to me, but maybe, this is what makes you feel your oats. It's about you. It feels good to you.
Feeling my oats. I like that. So let's talk about preparation. Do people need to do extreme preparation before starting anal sex?
Not at all. So typically, we have a self-cleaning oven mechanism in
True.
our lower GI tract that is going to help to keep the area hygienic. If you've had a bowel movement earlier in the day, that's likely going to have moved a lot of that stuff out, but you can also consider a quick rinse if that's something in your wheelhouse. We do talk about the ways that you can successfully clean the area through the
Yes.
douching mechanism, but this is not required or mandatory, and in fact, you can overdouche it. So
Yeah.
be cautious, be aware, and your diet is really going to help you determine what your GI tract is typically like. So you're able to kind of determine, hey, maybe douching is right for me, or maybe I don't need to do so.
And if you're interested in douching, we have a video where we explain in detail with visuals and instructions, step
Yeah,
by step, how to do it.
right. You don't need to turn your bathroom into a science lab. It's pretty simple.
Yeah.
So follow those easy instructions and see what you think if douching is right for you.
And keep it simple, right? I feel like that's the secret for anything in life. If you make things too complicated, you will not do it.
Right. And then you're just adding more anxiety and stress around the event, which makes it more complicated in itself. So, yeah, keep it simple, keep it relaxed. It's silly, it's fun. You're with a partner,
Yeah.
don't make it too serious.
Are some positions better for beginners?
Positions where the receiving partner is in more control is typically best for beginners. So, things like
Ah,
spooning, or if
spooning.
the receiving partner is on top, that way they can gauge what they're comfortable with and be in control of the rate, the rhythm.
Right.
And that way we prevent the beginner from having a poor experience.
So the bottom gets the steering wheel at first.
Yeah, the receptive partner is driving the car.
Yeah. So then, makes it easier and more comfortable for someone who's just starting.
Right. Again, the receptive partner is the one who is having to relax, keep everything under control, cool, calm, collected. So, yes, give them control so they can, steer the car towards the right direction.
So what about toys?
Oh, yeah. So toys can be great for beginners, especially if you're just starting to be more comfortable with putting things down there and investigating whether or not it causes or results in pleasure for you. So toys can be a great place because you can measure the size, you can determine what you're ready for. There are things like dilators where you can start with a very small size and work your way up so that when the event does take place, you are prepared. But they're not mandatory, right? Again, toys is not for everybody. It's
That's
not
true.
every beginner needs to start there. It's just if you're looking to plan ahead and you really want to be ready to go, toys can be a good option for you.
And we're not talking about massive dicks. We're
Oh,
talking about small plugs.
right.
We're talking about small plugs. We're talking about things that will make the experience better if you're a beginner.
Yeah, you said it. I'm going to just leave it at that. You're wild.
And so, what are the actual benefits of anal sex?
Right. So, number one, first and foremost, it's a bonding activity that is going to result in intimacy between you and your partner. There are billions of nerve fibers throughout the cavity that you'll be penetrating. And so there's going to be pleasure, of course. It's also the ability to rub or stimulate your prostate.
Right.
So we know that stimulating the prostate in this capacity can be a healthy way to release additional fluid that could be backed up and reduce the risk of prostate inflammation. But if you're overdoing it, there can also be damage to the prostate, right? The prostate is close by.
Wow.
So you don't want to be aggravating or inducing more pain or more irritation. So listen to your body. It's going to be talking to you throughout the process. If you're experiencing pain, that should not occur. You need to stop, address the situation, investigate the situation, and maybe come back once that pain has resolved.
So, yeah, like we say this in every single video, balance is key, moderation is key. You don't want to be banging your prostate 24/7.
Yeah, be gentle with the P spot.
P spot.
You know.
I thought it was the G spot.
Well, the G spot doesn't really exist, but it is a hypothetical position or place within the female genitalia. And so
Oh,
we are being
generic.
correlative
Right.
with the P spot and saying
Right.
that there's this imaginary spot. But we do have a prostate, so you
Mm.
can't say that is the P spot, but I digress.
I just want to keep the G spot for me.
Okay, G spot for Gabriel and P spot for Tyler.
All right, so let's be more serious and talk about safety.
Safety is a serious topic. You're absolutely right.
Is anal sex safe?
Yes, if you take the appropriate precautions and you are ready to proceed with the encounter in a stress-free and relaxed capacity, right? So
Yeah.
if you are going at it with a new partner or you are unsure of their health status, you of course want to use condoms to reduce the risk of infection, using plenty of lubricant to again coat and protect the mucosal layer of the tissues that are present, having that consultation beforehand. Hey, let's talk it
Yeah.
out. What's going to happen here? What do you like to do? What do I like to do? And then, of course, making sure that throughout the process you avoid any pain or any triggers that result in you feeling uncomfortable.
That makes sense. It's important to make sure that you're comfortable and you're ready for some banging.
Exactly. And remember the gentle aftercare, right? Once things are done, you want to make sure you cleanse the area with a gentle or mild soap and water, and then just let things be for a while. You want to give yourself some time afterwards before you go to round two so that the tissues can heal and be ready for their next round.
Do you have any tips or recommendation for beginners?
Yeah, my tips are pretty simple. So, number one, understand your anatomy, just the basics. Number two, make sure you're communicating with your partner what you're expecting and what they're expecting. And then lubricant, 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 and more lubricant.
Never enough lubricant.
Yeah, make sure you're relaxed, make sure there's no stress between you and your partner, and that you're ready to use those breathing exercises to get you through any humps along the way.
I feel like it's important to know what lubricant you like better for your body because there's so many different products out there and some may irritate your prostate and others might be better, more smoother for you. So it's important to like get to know the products and the kind of lubricants that are out there so you can have also a better experience.
Exactly, yeah. So there's water-based lubricant, there's silicone-based lubricant, and everyone has a different preference. Both are fine. You just want to make sure you find one that is consistent, so it's going to stay and remain throughout your episode, and that you
Right.
don't have any irritation to it, right? It shouldn't cause any itchiness, any burning, or irritation to the skin. So if you're experiencing that, stop because that irritation is already causing inflammation in the mucosal
Right.
tissue, and we don't want to add more irritation by adding trauma through penetration. So maybe test it out a little bit first with a toy, by yourself, with a finger, see how it goes, find your favorite, and then use that one when you're ready for the rendezvous.
Is Vaseline safe?
Vaseline can be safe if you are in a relationship with a monogamous partner or with multiple
Wow.
partners that you are very trusting with because Vaseline can break down condoms. So, in general, you typically
Right.
aren't going to be using Vaseline with protection like condoms. So, it can be useful if you are not concerned or not stressed about the potential STI that could result from using Vaseline with your
Wow.
partner. So it depends, right? Talk to maybe your partner, see what comfort level that you are together,
I see.
and make sure whatever lubricant you're using, it does pair well with the condom
Right.
if protection is a part of your rendezvous.
That makes sense. So if you're using condoms, no Vaseline.
Right.
Penetration, that's another drag name right there.
Yeah, we know
Actually, she already
Penny.
exists. She's out there somewhere.
She's out there somewhere.
Maybe she's watching this video.
Hey, Penny.
So to summarize all the tips and recommendations for beginners,
The recipe is slow, slippery,
and
and
supportive.
supportive. Yes.
Support is everything.
It's everything.
Now, I feel like it's a common fear. People often think, is my butthole gonna wear out?
Well, believe it or not, the body is quite resilient if you respect it. So
Resilient.
as long as you are using the tips we've discussed, taking it slow, avoiding pain, you shouldn't experience any long-term detrimental effects of anal intercourse. These are very rare and unexpected outcomes that would occur by performing activities that are obviously resulting in irritation and pain throughout the process. So
Makes sense.
the issue is, if you find pleasure from pain, which is a very real and very common response, and that is okay, just be aware that pain is also an indicator that your body is getting damaged.
Right.
So find that balance between pleasure and pain if you're one of those people where pleasure and pain sort of overlap.
Right. Some people like pain while having sex.
Yeah, and that's a whole nother topic for a whole nother day.
Maybe another video. That's a good topic.
Yeah, maybe.
Yeah, maybe. That's a little too controversial.
You know, we do our best here.
So butthole, that's another drag queen.
Another drag queen. We have penetration. We have butthole.
How many more
How
are
many more? Just keep
part
them
of
coming.
the family?
We should call this the anal family.
The anal family, the dynasty. Hey, butthole, if you're watching this, big fans.
Big fans. Literally.
Let's talk about some myths and misconceptions.
Sure.
Those are always fun.
Yep.
And I feel like you always give me a false answer.
Uh-oh.
Let's see if you're going to give me any truth today.
Okay. Let's give
The
you some
truth will
truths.
set you free today.
Absolutely.
Is anal sex always painful?
So anal sex should never be painful. That is an indicator that things are not going as they should. And so you should stop, take a break, investigate, reassess, and then repeat when ready. So no, there should be no pain.
Does anal sex always cause incontinence?
So anal sex should never cause incontinence.
I see.
Incontinence will occur if you damage the internal sphincter, which we talked about previously. So that musculature that is involuntary, meaning your body is contracting and relaxing it depending on how stressed or tense that you feel. So if you are damaging that internal sphincter, it can cause something called incontinence when you're not really able to control your bowel movements. This is extremely rare and something that people often will stereotype that could occur from anal sex. But again, as long as you are following safe, respectable policies for you and your body, that should never happen.
Is anal sex dirty?
Well, depends. All sex can be dirty.
True.
It depends on how you view sex, right? So there are many mechanisms in our body that regulate the hygiene of our lower GI tract, and there are additional things you can do to add more layers of hygienic protection. But no, anal sex is not dirty unless you are believing certain things in different capacities than we are here on the medical channel.
Right. Does anal sex make you gay?
Absolutely not.
Really?
Believe it or not, nothing that you do will make you gay. You're either gay or you're not, right? So
That's
no
true.
activity or behavior is going to change who you are. Now, if you enjoy things in the backside, you can call yourself whatever you want. I'm not
Right.
here to give you a label. That's your job. But no, anal sex is something that can be embraced and celebrated by straights, gays, anywhere in
Right.
between. It's just whether or not you're open to trying new things.
Yeah, and as we learn here in these videos, if you have a prostate, a P spot, you will feel pleasure.
Yeah, and believe it or not, females don't have a P spot, nor do they have a prostate. But there are so many nerve fibers and so many blood vessels that make the tissue sensitive that very often females can find enjoyment with anal sex too. So it's not just for the guys. The ladies can enjoy it too.
Is anal sex always about penetration?
I guess it depends on sort of who you are and what your goals are, but there are many areas around the anus that also can experience pleasure. So we talk about the perineum, that tissue that sort of
Right.
outlays the tissue between the scrotum and the anus as well. So there's a lot of pleasure to be had there. There are things like topics we've discussed, rimming or
Right.
other things you can do externally, and you can kind of prepare yourself to what anal sex looks like for you, right? Some people use toys, some people use fingers, some people use genitalia, doesn't have to be penetrative. Whatever you're ready for is where you should start.
There are many ways to feel pleasure over there. It's
Yeah.
either a tongue or a dick.
Oh.
You'll feel pleasure.
Finger, rubbing, massage, all sorts of options.
So this summarized all my questions.
Wow.
Yeah, very quick. I feel like we are pros at anal sex.
You said it.
We've been talking about these many
Right.
times.
Just talking.
As reviewers also have been listening to these topics. So I guess this was just a refresh to their memories.
Exactly. So if you want a more in-depth discussion, we have probably longer videos that you can review.
Probably, yeah.
But this is the overview and everything
Yeah.
you need to know.
And I'm glad that you made it this far. And as we learned here today, sex can be pleasurable, healthy, and safe.
Exactly. So let us know what you think in the comments if you have any other questions about this type of fun activity. But if you haven't already, please like,
subscribe, comment, post it, share it, do what you want.
All those things.
Yeah. And we'll keep posting more videos about sex education.
Exactly. We look forward to seeing you at our next video. But until then, see you later.
Bye.